Well, thanks everyone for joining us this evening. We'll get kicking off just in the interest of time, and I know it's an evening for people, so you've probably got many other things you want to get back to afterwards, and we've got a little bit we would like to cover off. So welcome to our webinar, Reaching Business and Financial Potential, presented by AgPal QIP on behalf of Northern Sydney PHN. I'd like to start by acknowledging the traditional owners of the land which people will be widespread on this evening, and pay my respects to elders past, present and emerging. Also acknowledging that this webinar is supported by funding of the the Sydney North Health Network, or Northern Sydney PHN, through the Australian Government's PHN program. So my name's David Osman, and I'm part of the AgPal and QIP education team that is presenting this evening. And just way of background for those people on the line, I'm a healthcare practice manager, also own my own general practice, and I'm based in Melbourne. I do a number of these types of education things, which is really great. I enjoy doing it. And I'm also an AgPal co-surveyor, so I have the opportunity to visit general practice, to talk to many people about the way they operate their practices, and I find that a really enjoyable thing. So hopefully some of the learnings that I get from those opportunities I can share with you this evening. So what we're hoping to cover off is really, I guess, a lot of information first of all, and so I will try and cover as much of the basis as I can in the first part of the webinar, but we want this to be as interactive as possible. So if you've got questions, feel free to pop them in the chat box that you can see on the Zoom platform there. We can come back to some of those questions. We'll have an opportunity at the end to do a little bit of a Q&A, so really keen to hear thoughts that you may have, questions that you may have specific to the topic that we're talking about this evening. You may have your own experiences which are really relevant as well, and we'd be certainly keen to hear about those. So if you have things that come up throughout the webinar, feel free to chime in by popping them into the chat box, and we'll try and come back to those at the opportunity when we can ask some questions. You'll be able to take yourself off mute if you'd like to ask something a bit more specific, or join in the conversation at that point in time, so that we can try and get through as many things as we can this evening, and cover off on what we're hoping to get into the agenda. So just to give you a really quick overview of what I'm hoping to talk mostly about this evening, I think that the most important thing that this topic is really framed around business planning. So our agenda is really much around what are business goals, what are the things that we need to think about in our practice when we're doing a business planning process. Of course, as part of that, we need to be identifying what are the risks to our practice and to our business, and certainly there's a financial element of that. We'll touch on a little bit of a high level around some of those financial aspects, and obviously I'm going to share with you as well some templates and things that you might be able to use, some suggestions. I'm sure there's also many other things that you use already with your practice that might be really useful, and maybe there's some tips and things that I can share with you that can hopefully help you improve, or at least use those templates and tools to suit the needs of your practice and the business planning processes that you already go through or that you're working towards within your team. And the other thing that's really important is when we're thinking about business planning in the context of our practices, it's important to look at the strategies that really support practice engagement with our patients, because they're the drivers, they're our customers, if you like, of the service that we're providing. So we need to be really focused on them throughout this process. So hopefully we can also look at some of the aspects of how you might engage in that part of the process as well. So that's just a really high level overview of what we want to talk about. But let's get into some of the detail around all of these elements. So probably for all of you on the line there, I don't need to explain to you in great detail about what business planning is, but I'm just sharing with you, I think, for me, at a high level, what I think the important parts of a business plan look like. And certainly when I think about the concept of business planning, this is what first comes to mind for me. Certainly having a business plan to run your practice is absolutely critical, and we'll obviously touch a little bit more on some of the reasons why we do that. But the business planning process, and I've been through this a number of times with my practice and working with other practices as well, is that it's very much about ensuring that we've got to look at our priorities. Why does the practice exist? Why do we provide the services we're there to provide? And what does that look like from a sustainability perspective? So the financial elements that we'll get to a little bit later on as well. And obviously the other really important component about that is how do we evaluate what we're doing? And that's a really critical part. There's no point in us developing a plan for our practice if we don't have a mechanism to evaluate that, and we don't need to go back, if we don't have a way to go through those things and make sure that we're actually achieving what we want to achieve. So a really well-developed business plan is a critical part of whether you're setting up a new practice, whether you're revisiting what you're doing in your existing practice, if you're going into new territories or new services, the business planning process is an important part of that. Well-prepared business plans, I've found in my experience, will set you up for all of those processes and all of the things you want to achieve. So that business planning process, it doesn't need to be complicated. One of the things that we sometimes think about when we start looking at planning, whether it's our strategy, whether it's developing these types of plans, if we overcomplicate it, then it gets a little bit exhausting and we don't know, where we are. So the business planning process, hopefully, when you think about it, think about the simplicity around it first, and then obviously some of the processes that you use to support that. So at a high level for me, what does a business plan need to include? And I think very much when I think about planning for my practice, it's about understanding all the elements of what we currently do, what we want to do, how we want to achieve that, and obviously looking at the outcomes and evaluating that is also a really important part of it. So at a high level for me, what should a business plan include? And I think the first thing is understanding what is, whether you describe it as the market, the demographic, whatever way you want to look at it, but however your practice delivers services, looking at a high level, what does that look like? And that might be a process that you go through very much about doing a bit of analysis, and there's a few ways that you might go about that. It's also looking at what types of, whether they're services that you provide, what they look like, how you would describe them, and then very much about being able to put those into something that you can articulate to the people that you want to deliver the service to. And obviously in the case of our practices, that's our patients. The other really important thing, and I think we should neglect to put a lot of effort into understanding what is the value of the service that you're providing. So for your practice, what is it you're delivering, and how does that link into the values or your mission, or why you even exist? Asking the question, why have we set up this practice? Or if it's been operating for many years, what's its main purpose? How did it get to be where it is? And then start linking those two things together. The other really important thing in business planning is we obviously look at the financial elements, and we'll come back to financial in a little bit more detail later on. Risk management, and that's certainly an important thing in general practice, and it's becoming a really important part of things from an accreditation point of view. But when we look at it from a business perspective, we need to really evaluate risk. And I'll share with you a few examples of things that I think are really important in terms of risk management. Once you've decided what that framework looks like, then it really comes into how do we turn that operationalized. So you need to have an operational strategy. It doesn't need to be complicated, but when you've determined what is it you're going to achieve, how you're going to achieve it, you then need to put in place a range of steps to make that happen. It could be as simple as an action plan. It could be a way that you delegate some of those responsibilities to the team that are involved. But you need to have a strategy about how you're going to operationalize what you're doing in your business plan. And of course, that financial part's really important, because especially where you're making some investment in the practice, you need to have a process to be able to evaluate, is that actually achieving what you needed to achieve? So I guess for me, when I think about starting the business planning process, it's really important that we focus on the service that we're trying to deliver. And of course, in the medical field, patient care is got to be centered around that. So the first question I ask when I start thinking about business planning is, do you actually know your patients? Do you know the demographic you're delivering? It might be a simple answer for you because you've been delivering to that demographic for a long time. But if you're going into a new market, maybe you're setting up a new practice or a new branch to your practice in another location. Do you have a really good knowledge of all of the demographic that you're going to be targeting? Because you need to be able to craft the service that you deliver around those people. So asking that question before you even start the business planning process, do you know who your patient demographic is? Because the plan needs to focus around that. And I'll come back to a couple of ways a little bit later on where you may focus on some of that demographic information. The other important thing to think about in the business planning process is there are really two key things that we need to separate when we're thinking about planning and a strategy. And I think there's got to be a really important understanding for everyone involved in the process that the strategy has sometimes really critically got to be developed before you can put together a business plan. So, you know, when you look at your process, whether you develop a plan with a number of stakeholders in your practice, your staff, your team, you've got to understand really for what is that, going back to the demographic and the purpose, why is it you're wanting to deliver it before you can look at how you implement some of the strategies. So from a planning perspective, I think there are a number of tools that I'd suggest to think about, and you know, just going on Google, you could find out templates and things that surround some of these tools that are available. But if I go back to doing a basic business planning process, what's the first thing that I do when I look at what are the components of the plan that I want to implement, and certainly understanding what's good about what you do if you're looking for an existing practice, for new practices, you know, what's good about the things that maybe your competitors are doing, and then also looking at all of the elements about what actually is needed. So, you know, what's the gap you're trying to fill in terms of your service that you're creating or you're expanding into, and so a SWOT analysis is really useful for that. There's some really simple templates and tools available for doing SWOT analysis. For me, it's very much around understanding the elements of, you know, what's currently there, what are some of the gaps that we're trying to get involved in, and also, I guess, you know, from a resources perspective, you know, what do you have and don't have, because that'll be an important part of determining that operational part of your strategy. There's some more complicated tools as well that are available if you want to get into that really detailed level of business planning process. So thinking about using some of those things that might be more strategic focus, like the PES tool, that's very much a strategic focusing, looking at, you know, tracking and evaluating you know, things like economic factors. But I think if it's the first time you're going into a business planning process, I'd start with thinking about what are the gaps that you're trying to fill. You know, what is the purpose of why you're you know, setting up a practice, or if you're trying to expand your practice, what are the gaps you're trying to identify? And just using a really simple gap analysis tool can be really helpful for that. So as an example, for some colleagues that I was working with a number of years ago who were trying to set up a new practice, one of the things that they really needed to identify in a really saturated market, in an area where there were a lot of general practices, is what are some of the things that the current demographic that they're going into is actually missing out on. And so they picked two key areas that there was, I guess, a little bit of a lack of support around, a lot of services that were missing in that particular area. And there's a lot of ways that you can go about that through, you know, doing your research at the market. It doesn't have to be complicated. but certainly doing that gap analysis in a particular demographic is an important way of, putting together the strategy. So they picked two areas that were really important for them, and they were gaps in the market. And as a result of that, when they did their business planning, they focused on establishing the practice to meet those particular needs in the community. And that paid off. So the next time they were able to get into business planning and processes, they were able to look at expanding services and using that same replication of opportunity. What comes with doing that whole planning process is that there are a lot of risks involved in setting up a new practice. There are a lot of risks in expanding your existing practice services. When you go into a new market, you've got to evaluate all those things because there are financial implications, reputational implications. You've really got to look at all of the things in your business planning process that could go wrong potentially, because obviously when you go through a process of making investment in a new service or expanding services, you don't want to turn around and find that you're in a situation that doesn't necessarily pay off for you. But when I think about business risk, I think there are a number of things that we need to consider. So first of all, from a risk perspective, there are a number of things you can identify within your own business that are risks, whether they're from staff, individual needs, whether they're from technology, whether they're from whatever you have in place to be able to deliver those things. Do you have all the tools that you need? That can pose a significant risk for you. When you're setting up a practice, it's that supply demand kind of thing. Can I get all of the things I need to have to set up the practice in a timely way? Are my timelines associated with those things realistic? Obviously, there are things that you can control and things that you can't. So, the COVID situation, I've talked to a number of practices who've established themselves during COVID, and surprisingly, yes, it's been a difficult time to be setting up practice or to be moving and setting up other services. But, that's a factor that's going to be something when you go through a business planning process, you're not going to know. It's going to be unpredictable. But can you make account for that in your business planning process? Can you look at those risks if something like that happened to you? And of course, there are also opportunity risks as well. Sometimes we neglect to think about these ones because, if we don't identify them during our planning process, then sometimes we may overlook the fact that not doing something in a particular market could be a bigger risk for us. So where there's a gap in services and we make a decision about whether we should do it or not, what's the opportunity risk associated with that? It could be very much about the fact if we don't do something, then we're in a situation where somebody else might meet that demand for us. So you've really got to evaluate that in a bit of detail when you're looking at what are the opportunities and what's the lost opportunity potential as well. So, setting up a new practice, there's obviously a lot of, processes that you go through from a financial assessment point of view, but also from a, is there a demand in the market? And then, on the flip side of that, what is the risk if we don't do anything about it at all? I guess, we also need to think about, when we're talking around risk, that there are those things that are unpredictable, that we're never going to be able to have a really good handle on, like pandemics and natural disasters and so forth. But there are also things we can control and things that we can assess before we make decisions about whether we should go into business for something or whether we should actually set up those services. So, the changing way that things work, whether it be staffing or whether it be Medicare or whatever it might be that we use as a factor in our business planning, some of those things we at least have some control over. So, we can develop some strategies to support what we know is going to happen, certainly in the short term. Longer term, Medicare is something that we're not going to be able to have full control of understanding what that looks like in 12 to 18 months time. It's an evolving thing. But what do we know that's going to happen in the next month if this is part of our business strategy? It's the same with staffing. If we've got already existing services in place, some things we can control in that space. We already know what availability of staff we might have over the next couple of months. And so will that be a factor in whether or not you can establish a new service or not? There's a significant link, obviously, between risk and financial impacts. And so when you go through the process of doing a business plan, you need to think, quite clearly about how those risks will impact on your business plan. And obviously, there are probably a number of things, as we say, that are predictable and not predictable. Can you do that in your business plan process? Well, I think you can, because you can do some level of prediction around the things that you can control. Obviously, the things that you can't control, you can build in some buffers around that. You can put in some opportunity, from a cash flow perspective, to look at those things in isolation. But the things that you can control, obviously, those parts you can do some cash flow prediction around that. Cash flow is obviously going to be an important part of the business planning process, because when you are establishing a new practice, or you're creating new services, you've got to think about, what if it doesn't financially work? What if the patient numbers drop off? What if it doesn't even get off the ground because you don't have the base to build from? And so that risk management process, and they're going through assessing risk. How realistic is it for you to, for example, start a practice with 10 GPs, all in a new location, that are going to have full books from day one? Well, it's probably realistic to start looking at the risks about, if you're going to put all your eggs into that, how achievable is it? But then, how can you eliminate some of those things? So whether it's a build-up of services, or whether it's offering other services that might impact on it as well. So it's obviously really important to get risk into your business plan. And, I think I labor on risk a little bit, because it is the biggest part for me of a business planning process. Yes, we've got to develop those operational strategies. Yes, we've got to look at the finances behind, how we do everything in our business plan. But risk is really, I can't stress enough to you, from my perspective, risk is an important part of the business plan that we need to evaluate at every single element. So, just breaking down, I guess, for me, the way in which I include business risk in my plan is that there are two separate components. There's the assessment of risk, and I would be really inclusive around any opportunities that you think may pose a risk to your plan. Whether you're setting up practice, when you're expanding services, whichever it might be, think about everything that could go wrong. Anything that you've had go wrong in the past, anything you've seen other people that may have gone wrong in that business planning process, just encapsulate every opportunity you can in terms of doing a risk assessment. Think about all the factors that can change. Certainly the last 18 months or so is probably, for everybody, you've seen all of these things happening in different ways, the different risks that have been posed to our practices from the result of having a pandemic. But even if you put aside the other things that you will have encountered, whether it's the natural disasters, and lots of practices have been impacted through floods, bushfires, all sorts of things, that they're just a common part of, unfortunately, when we're operating in business, they're things we can't control. Not to underestimate as well the risks associated with whether you just don't have enough supply and demand. So in many areas, getting GPs is really difficult. There's shortages in nursing support if you need nurses support in some places as well, even to the point of how difficult would it be to get your medical admin support, practice managers, admin for front reception, all of those things you really need to assess, step by step. If you're setting up a practice, how would you get all those things in place? And certainly if you're changing what you deliver, absolutely making sure that you look at those in great detail. So I labour on about that little one, and I don't apologise for the fact that I think this is the most critical part of a business planning process. Risk, risk, risk. If I can't say that enough to you, make sure that you consider that when you do your business planning. And of course, there are a number of ways which you can tackle these things. So doing that risk assessment is the starting point, but then what are some of the ways you can mitigate those? When you go through that planning process as a team, when you identify them, the first part of having in place some strategies to support that might be some of the things that will be able to mitigate whether those risks are as high for you in your business plan. And when we think about risk, and also just in an overall business planning process, the other important thing is that we are really inclusive around the people that are involved in the process. So when I look at doing risk assessment for my business and in our practice, I'm not just thinking about all of the risks that I can identify. You've got your team out there that are working day to day. They're going to come up with some of the things that you don't even think about. Often when we need to implement systems and processes, I think about a number of elements because of my experience, but there are so many people out there, and even within our team, that can provide expertise around these things as well. So the things that you don't think about can often be really some of the components that make up your business plan. And I think that patients have got to be really something that we sometimes overlook in that process as well. Patients may identify risks for you when you're developing your business planning process. So on that, I think it's really important for you to think about how do you gain patient input into the planning process. Establishing a new practice, that may be an element of doing the market research, doing the understanding of what currently exists out there in the marketplace, talking to patients about what their needs are. Why, for example, if you're setting up practice, are you setting up a new practice? It probably is a result of feedback you've heard that there is a gap in the market, talking to people about that. But in an existing practice, we're always hoping to gain feedback from our patients, who are the clients of the service. They're the ones that that are driving the financial elements of it. So they can also be involved in providing really important data in the business. If you want to expand services, you want to offer a new service, why would you not ask your patients whether that service is going to be value to them before you make a decision about going into it? And there are lots of ways you can collect data, of course. We do patient feedback surveys, things like that, when we are going through our quality improvement processes. But do we test new ideas and new questions with patients around particular services? I'm sure for practitioners, clinicians out there, when you're thinking about should we offer something new or a different service to our patients, you probably do have that process you go through where it's because you've heard feedback from patients that we're missing something here. And you may even test that theory with patients when they come in, asking them whether or not this would be of value to them. But do you formalize that? Sometimes some of the greatest ways we've identified gaps are through asking patients, what do they need? What are the things that are the bugbears for them about our service? They can create us really good business opportunities as well. But it's how you use that feedback, obviously, when you're developing your business planning process. you know, the power of that data that's really, really important. So when we have developed strategies around some of the things we want to do, there are obviously a number of things we need to evaluate from a funding perspective. Now, this is a tricky one, of course, because the way that you fund your practice in today's day and age can be so different to what it may have been a few years ago. The prevalence of bulk billing is probably not the same mix that it used to be. So if you're setting up a new practice, you know, you've got to really test out that market about what competitors are doing, what are the services that are being offered. When you do that gap, I guess, identification, you know, is there the market for you to deliver services financially from a bulk billing perspective, but also, you know, if you're adding services or creating new services, this is really very much around that process of evaluating what are the funding models associated with this. So, you know, I think about adding new services, you've really got to understand what is the service that you're wanting to add to the mix, and then how would you essentially make that pay for itself, because otherwise, you know, you're not necessarily going to consider adding that to the portfolio of things you do. There are, unfortunately, in the market that we're in medical practices, there are a lot of things that are unfunded. But are there creative ways that you can think about engaging people into activities that are really valuable to them? So some of the services that you might provide, those add-on services, you know, are there ways that you can be engaging with getting people interested in purchasing services from your practice, or, you know, getting other health professionals involved in the process as well. You know, it might be as simple as, from a general practice perspective, you know, have you got other allied health providers involved in delivering services to you? You know, are those services being delivered within your practice? But it could also be, you know, what is that point of difference, something that you offer that's really important. You know, whether you do something in your treatment room that's really valuable to patients and they're willing to pay for that service. One of the examples of that I've seen quite prominently over the last few years is a rise in doing things like iron infusions, because the accessibility of general practice to get involved in that, you know, for some patients, paying for that service outweighs the time and effort involved in doing them in other settings, just as an example. There are other funding models available as well. So, you know, whether we're delivering services to particular demographics that might be funded, whether there's private health insurance and other things that we need to consider as well. But the funding component of your business plan is really important. And I think that you know, first of all, identifying, you know, all the services that you want to deliver. If it's a new practice, if you want to expand your current practice, what are the services you're trying to add? And then look at the financial elements of how much does it cost you to deliver that service, and how you're going to pay for that when you're offering that to your patients. When you get into that financial part of the business planning process, you need to also obviously have a really good idea of the basics, I guess, for your practice around good financial management. Now, I'm not going to go into a level of detail around how you manage finance in your practice, but what I will share with you at a high level for me is what I guess are the basic financial management tools that I use in my practice. I'm not a financial expert by any means, but certainly as a business owner, as a practice manager, I need to use tools in my practice for evaluating the financial components. And I'm sure all of you use a number of things as well to look at how are you tracking. But when you're setting up a new service, when you're establishing a practice, it's really good to have these basic things in place right at the get-go. If you don't have them in place, there's never a better opportunity for you to look at those basic elements and make sure that you're doing on a regular basis, reviewing them, making sure that you've got all of the controls in place, working with your accountant and your financial advisors around what are the tools and things that you need to have to support these. And I think the most important part of business planning that comes into this basic financial component is the reporting. So when you develop a business plan, how do you set some metrics to identify, are you tracking well? Are you going to continue to, invest in the process? Is it delivering the financial elements to your practice that you need it to deliver? But on a day-to-day basis, in that sort of business side of things from a financial element, are you looking at all the reporting tools that you've got in place for your practice? Have you got a really great cash flow understanding? And that will influence your business planning process. So if you know what cash flow looks like for your business and your practice, can you invest in some of the things that you're wanting to do? You'll have to have all these things in place when you're establishing a new practice, of course. You've got to put together this business plan. You've got to get the financial backing if you're, if you're not funding it yourself. But even if you are, you need to have all of the things on a day-to-day basis that really support that. So practice income, something obviously that you can control when you're setting up the reporting mechanisms. So for me, in really simple terms, these are things that I think you need to understand in terms of practice income. So really simple tools and reports. Obviously, income statements are really important when you're developing a cash flow. You need to have a really good reference point. So if you do this on a monthly or quarterly basis, and that's probably what you would do in your existing practice. But if you haven't, and you're setting up a practice process, put in place something that you do this from day one. Understanding what, when you go to the bank, for example, to get funding to do these activities, they're going to ask you all these questions about what are the assets and liabilities, whether or not you do a prediction about what the return on investment for you is going to be, and obviously the bank, can you financially afford to take out a loan, for example, to set up a new practice. So the income part of it's really important, and then understanding very much in detail, I guess that way you can set goals for your practice, and you can set goals in your business plan. Whether it's part of day-to-day business in your practice or whether you're going through a business planning process for new activity, it's critical. And I think, for me, looking at on a day-to-day basis about cash flow is obviously really important. But what are some of the good things that you can do to ensure that you've got your priorities set around goals and strategies? And financial KPIs can be a big part of that. So whether you're going through setting up, as you're going through that business planning process, what are the markers for you? At 3 months' time, what do you need to have achieved from a financial point of view? 6 months, 12 months, whatever your timeline is around the plan, set those markers really early on, because there's no point, 6 months into trialing an activity or setting up a practice to start asking questions. How do we know how we're tracking? So having those goals in place really early on in the process is absolutely critical. I wouldn't start spending money on activities until you've got those measures in place. Obviously, your financial advisor can give you some really good benchmarks around that, and looking at it from a viability perspective. But you need to be obviously really involved in determining what those goals look like when you're doing that process. And that then financially, KPIs can be really important. You might not use the term KPI, you might use a number of things that talk about essentially what I'm getting at is really, for me, what is the key financial performance of the practice looking like. So we can evaluate that on a number of levels. We can look at, you know, firstly, what does cash flow look like? We can also look at, you know, how we're performing on a month-to-month basis, on a year-to-year basis, and those important reports and things that we talked about, you know, they will tell us a number of these things. But we also need to look at KPIs from a perspective of patient and data, and I'll come back to that in a moment, because there are obviously a number of ways that you might go about that. Satisfaction is really important. So you can monitor satisfaction from both an employee perspective, from a patient perspective, and I think that that's something I do on a really regular basis, you know, with my teams, is looking at, you know, how, not only obviously how the financial elements of the business are tracking, but if those things around patient satisfaction and staff satisfaction are going to influence quite heavily on whether we're successful on a day-to-day basis. Because if we're not getting satisfied patients, they're not going to come back to us. We're not having satisfied staff, you know, then they're not going to help us drive the business. They're not going to help us achieve all of the goals that we're trying to get to. And obviously, really importantly, when we think about cash flow, we need to set some KPIs around expenditure, and this goes right back into that business planning process at the very start of it. You know, what are we prepared to spend on setting up new services, on setting up a new practice? How much can we afford? And all of those things will be really important to you as you evaluate going along that journey. You know, what are our KPIs and benchmarks around all of those things? So I guess, you know, if I come back to the summarizing of the financial bits for me, it really comes down to, have you got goals set for your practice financially? You know, what do you want to see? If you're setting up a new practice, what do you want to see in the first 3, 6, 12 months? What does that mean if you're setting up new services? You know, where are you going to put some milestones in? How do you know when to evaluate? Are you doing well? Can you do better? You know, what are the next part of the business planning processes look like? So from a business planning perspective, I think it's really critical for us to think about, first of all, you know, a business plan in a new practice, an existing practice. It's the roadmap for your practice. You know, it's really needs to set out from the very first steps of why are we doing all of these things, right through to, you know, how we're going to achieve them, how we're going to evaluate them. The other important thing is that inclusivity around the financial components of it. So having a business plan, you know, for me, having it documented gives me some assurance around the security from a financial perspective, but it also means that, you know, I've got something that I can go back to and continually evaluate. You know, are we doing all the things that we want to do from a practice perspective? Am I doing all the things financially achieving what I want to achieve? Business risk, you know, I did talk about that a little bit before, and, you know, I said I laboured on that point as it being really important, but I think, you know, it is critical to the business planning process that we evaluate risk. So, you know, when you're developing a business plan, have you evaluated all of the elements of business risk that are both within your control and not within your control? Have you identified what those risks are both within your practice and external to your practice? So don't just think about those things that from a market perspective when you're setting up a new practice. Think about what the internal risks are too. If you don't achieve deadlines, if you don't have the right resources available to you, because those things will obviously have an ability and an impact on your financial ability to operate the service. So when you evaluate risk, make sure you think about all of those things. Risk from external, obviously, these things are, just really very much a feature of what we've seen in recent times. But natural disasters, pandemics and things, they're just going to be something that you need to focus on when you look at business risk. Business planning really has to have that focus around patient-centered care, as I said. So I think when you look at the financial elements, you need to come back to seeking feedback and getting those fundamentals from patients in the process, and staff, of course. They're really important. And using the tools that are available for you to be able to look at what funding is relevant. So, understanding what the funding elements of your business plan look like, understanding what income measures might be really important there, and how you're going to measure those things, and not underestimating that process around setting goals and setting KPIs from a financial perspective as well. Now, I just wanted to draw your attention, I guess, to a few resources that I think are really relevant to this process. When I have gone through business planning in my practice and working with a number of practices, there are some great tools out there that aren't going to cost you anything but time and then putting that effort in there. So the RACGP has some great toolkits from a general practice perspective. The General Practice Toolkit, which is available on their website, and the General Practice Management Toolkit. Both of those tools are really quite useful. I've used them for developing some of the strategies that I've put in place into my practice. More relevant, of course, in recent times, emergency response and pandemic planning. And these tools are really helpful when you're thinking about the business and some of those impacts, some of those risks that we mentioned about before. There are endless supply of business planning tools out there. So this is something that can get a little bit daunting, I think. But you've got to remember that when you're going through a business plan process, you've got to keep it simple, or you've got to keep it to the level that's really appropriate for the audience, whether it's you and your team, whether it's other people, whether it's banks or other people that are involved in that process. But overcomplicating the business planning process, I think, is one of the biggest traps when you think about it from developing a business plan. So there are some simple tools that I've certainly found to be available online that are really, really useful. This is just an example here of keeping it simple, keeping a business plan to only a few pages, not overcomplicating. Looking at it from a business perspective is, what is it that your business is trying to achieve, and of course, for practices, what are the services you're delivering to patients? Very, very importantly, what are the ways you're going to deliver that service? And then some really basics around financials. There's also a business planning toolkit, and I know it's available in the AgPower Resource Library, but you can get access to that. The PHN can obviously assist if you want to download the resources. Just a couple of snippets out of there, because I think just touching on the things I mentioned early on around risk, I find this a really useful tool to be able to look at what are the basic risk assessments. So this matrix, for example, it gives you the opportunity to identify, what are the risks to the practice, and doing a really simple assessment of how likely those things are. So you don't have to overcomplicate the risk assessment process, but most importantly, what is it that you're going to do about managing those risks? So if it's a low likelihood risk. It's something that's, that you don't think is going to have a major impact on your business plan. You might not need much around your management strategy, but if it's something that's going to have significant impact, and that might be one of those extreme risks, it may actually be a decision-making factor around, should you go ahead with actually starting the new practice business, or going into the new activity. So these sorts of tools are really helpful. I think this can be just downloaded as a spreadsheet, so you can fill it in. But it's just one example of the types of risk assessment things that you might want to use in your practice. And the other thing when you're doing a business plan and looking at cash flow is you need to have a really simple way, of course, of looking at, first of all, what your forecasting is. So, setting up your new practice, what do you think are going to be the income streams that are coming in over the initial period and longer term? What does that look like? And there are a few different ways you can do that. This example here is just really incorporating a simple balance sheet and profit and loss forecast. So two really important things that every practice should have access to frequently looking at the business plan is your balance sheet and the profit and loss. But I think what underpins profit and loss processing is also very much about projected cash flow, because if you're going to be developing new strategies or implementing things, you need to know, what are the total incoming and outgoing activities from a financial perspective in your practice. So this one's really simple. It gives you the opportunity to identify all of the incoming financial streams to the practice and what are the reasonable outgoings that it's going to be at the end of that month, at the end of that 12-month period. And don't underestimate some of the things when you're setting up a practice. I've been through, setting up practice process, and it's really easy for you to underestimate some of the costs, whether they be legal costs, whether they be all of the things that you just don't expect to happen. So don't underestimate that when you're developing a cash flow. Some of the fees around accounting and solicitors and so forth, not just because there are lots of things to do, but there are unexpected things that are going to come up that you don't anticipate. So be realistic in your cash flow projection. I think that is really important. And talking about resources as well, we're just touching on that process that you go through. I guess when you're looking at new services or increasing the capacity of your existing practice, you really have to underpin that business planning process with data. So I know for practices in the Sydney North area that the PHN provides access to the PenCat tool. That's a really useful opportunity for you to look at the demographics of your practice. And I think there's just a couple of examples here of relevant data that, I just think these tools, we can't underestimate how valuable they are in a business planning environment, and looking at what are the things that we can do to improve the services that we deliver. So, just simply asking that question, which I said really early on, do you understand the demographics of your patient base? If the answer is no, then this sort of tool is really helpful because it gives you an opportunity to do that profiling of who you have. Obviously, having access to data like this when you're setting up a new practice, it's a little bit harder because you don't have a patient base that you're working from. But for practices that are trying to develop new services and increase what you deliver, this type of thing is really useful because you can drill down. Obviously, I'm sure many of you have used these types of tools in your practices. If you haven't, absolutely get in and start using them if you can, because if you want to drill down into some of the gaps that might exist for your patient base, they're really, really important. And part of that is very much about, you know, profiling not just who your patients are, but also very much around some of the problems that exist for them, you know, whether they're health conditions, whether they're particular services that they're not able to access. And this tool will give you a lot of data and information around that. And just a bit more of an example, I guess, really of the types of ways, the reports that come out of using these sorts of tools, they'll pick up for you some really clear opportunities. And mentioned early on about that opportunity risk, you know, when you look at these, when you look at the data that you get out of these tools, are you missing opportunities from a practice perspective? So if your business planning process is focused around improving overall patient and practice income from patients into your practice, this might be a really important way of telling you about that. If you've got a significant clinical condition, and that's, you know, this is obviously information that's been coded into your clinical software. Are you missing opportunities for getting health assessments in? Are you doing all of the routine things that that drive some additional revenue, especially in chronic disease management? It's a challenge, certainly in the current circumstances. Doing health assessments and chronic disease management plans is probably the last thing that you're thinking about in the middle of a pandemic. But we don't, you can see here that significant potential income in this example is if you're looking at the opportunities where you're not doing particular things for your patients, can this increase your revenue, and can it improve the financial elements of your business plan? So that's from a health assessment perspective, and also some example there of chronic disease management. And it's true that many practices will have huge opportunity in chronic disease management. It's the changing nature of the patient base. When we come on the other side of this pandemic, there's probably going to be even more chronic disease out there that hasn't been necessarily managed by patients that have been away from accessing health services. So we'd be really interested to see the data of that for practices as you come through to what is normal, when patients are spending more time face to face in our practices. But there's these tools that are really useful because you can identify, if I can see the potential income for chronic disease management plans, what does that correlate to from a dollars and cents perspective? That one is a really important thing. So I wanted to have the opportunity not to just talk at you for a whole hour and a half, but to actually, get your feedback around some of the experiences you've had and answer any questions that we can. But I'll just pop this up there so that anyone wanting to follow up with the team at the Sydney North Health Network, the contact details. I'm sure you're familiar with the team there already that can provide you support. But at this point in time, I might just have a look. Anyone got any questions that they might like to ask or talk about this evening? Because I want this to be an opportunity for you to share your experiences as well. There's a chat box there which you can pop some questions into, but if you want to unmute and have a conversation about any of those suggestions, you can do so. I think at this time of the night, everyone's probably had a pretty full-on day with everything going on, but I'm sure you've got some really great opportunities from what you've done in your practice as well. So I'd love to hear some thoughts from other people on the webinar this evening. I'm not sure, Alex, if there's from your PHM perspective, if there's any particular things that that jumped out for you that you wanted to maybe talk about.
Thanks so much, David. I think there's lots of content there for people to consider. I think some of the practical elements are really helpful for our practices. So hopefully people that have joined in tonight and maybe been able to take away one or two tools or thoughts that they can feed into their business planning process. I am wondering whether people might have some examples of things that they've included in their business planning, or if there was anything that sort of jumped out at you that you wanted to share your thoughts on, or ask some more questions of David.
And I think, thanks, Ashley. I think in terms of the tools and resources, obviously, we're not expecting you to take in all of the slides that we've gone through this evening, but obviously they'll be available later for you to get the links to them, so you can explore them later on. But I think that there are so many tools out there that you've got to find the right fit for you and your practice. What that risk assessment looks like, what the cash flow process looks like. You've got to find the right fit for you. There's plenty of tools and resources to get started on that. I don't know, from business planning that people have done with their own practices, have they found any particular resources or things they think are really useful, things that are missing that might be really helpful? Everyone's a bit quiet this evening.
Everyone is very quiet.
Yeah, very quiet. But I just wanted to say that something that I think resonated with me tonight is going back to your slides and your comments on the patient feedback and how important it is to hear the patient's voice and understand what it is that they're looking for, because they are really, in a business sense, they're your customers that you want to please. And yeah, I just think that was a really good slide and information that you gave there, because yeah, so I just wanted to share that.
Thanks. I think that's something that we can often go wrong if we don't talk to patients, or we don't consider them in the whole process, because we come up with great ideas in our practices. We think, oh, it'd be really good to offer this service. We think everyone would really want to access it. But if we don't ask patients, and then we invest time and resources into it, is that the best use of resources and time if patients don't want that particular service? So we've got to listen to patients in that. Whether you're if you're setting up a new practice, obviously asking about people that may potentially access your practice, what type of services they want, but probably for most people within their existing practices, just using that feedback from people, your patients, about what services there are, because we come up with great ideas and we're almost sometimes in our bubble in our practice because we think it's a great idea, and then when we test that with patients, they may say, well, what do I need that for? I'd prefer you focus your attention on this instead, and then there's something we haven't even considered. So yeah, thanks for that. I think it is a critical part of that process.
And also to the feedback from the patients about improvements to the services that are already being offered. I think that's another important one. And many of the practices that we've been working with over the years, especially the ones that have been involved in our person-centered medical home program, they have done quite a bit of work around the patient experience and having patient committees to help feed back into the practice on improvements to services and different ways of delivering care and services and what's important to them. So yeah, that's something to think about too. We have practices with experience in that. So yeah.
Thanks. And I think that it's really important when we're looking at gaps and things. So when we're looking at that information, demographic and billing information that we can produce from our clinical software, we might identify, for example, that health assessments are really low with a particular demographic, and the only way we're going to find out about why that is to talk to patients and find out, why don't you want to come in for a health assessment, or is it just not appealing enough to you, and can that be part of your business planning process? Can it be,
Mm.
you know, you need to deliver it slightly differently? I know in my practice we've had a slightly different uptake in chronic disease through the use of telehealth, because we have a demographic of patients who probably wouldn't have come into us before because they're busy, they're working, and so the use of telehealth has been quite useful in that particular demographic. But it's meant as a result there's another group of patients that are not accessing that service because telehealth doesn't suit them. So, you know, it's going to be different for all parts of the practice.
Mm.
Someone asked a question about is there standardized patient feedback forms that you could download? There are so many different tools that I've come across with that. I think that, you know, most practices probably look at, you know, when they go through a patient feedback process overall from an accreditation perspective, they'll go with you know, a process that's fairly standardized. But even the RSEGP feedback guide has got a really good basis of what are the types of questions you want to ask. I don't know if the PHN have any recommendations of templates or tools that you would suggest for patient feedback.
Yeah, if you reach out to us, we'll be able to push some of those out. Yeah, there's lots of different things, and we look we like to look at what's called PROMs and PREMs, so patient reported outcome measures and patient reported experience measures, and they're quite useful tools to yeah, basically get feedback from your patients.
Great. Maybe you can email later on if you want to get access to some of those tools. The team, I'm sure, will be happy to help push them out to you. So, but there are some really good patient feedback tools available. Other thoughts about business planning, about risk? Anything anybody would like to share? Any questions we can answer? We've still got a bit of time if anyone wants us to further delve into those things. It's definitely gone quiet at this time of night, but I think
you have. So I was thinking possibly you've covered all the questions that people wanted answers to, but there is the opportunity as well, as if you do have a question that you wanted to ask as part of the evaluation, please put that in at the bottom in your comments, and we can perhaps forward that to David, or we can look at it at the Primary Health Network and then provide some additional resources to participants as well. But yeah, are there any final questions for David while we've got him here on the line all the way from Melbourne?
No, look, I know everyone is really busy, and with lockdowns and things going on at the moment, it's a tricky time. So the fact that you've made some time in your evening to come out and think about these topics is really, really valuable. So thank you. As Alex said, the evaluation is really important. So if you've got questions and things we didn't capture, or you didn't want to pop your hand up and join the conversation at this point, you can feed that back through the PHN or through the evaluation. As Alex said, you know, the PHN team would be happy to answer questions, but certainly I know myself and the AgPal team would be happy if you want to feedback things through the PHN. We can answer any other questions as well, or templates and things that we can share with you. So we're more than happy to take those offline after the webinar as well. All of the tools and resources, I know the slide deck will be available for distribution after the webinar as well.
That's right, and we are recording the webinar this evening, which will also be a resource available to you if you did miss the beginning part, because you had other commitments. We can make that available. We can also make that available for other members of your practice team. So keep that in mind. I'm not sure when that will be ready, but we'll certainly let you know when it's available, along with those slides and any of the templates that you're happy for us to share, David. I'm sure that would be a very useful resource for practices. So thank you.
No worries. Yeah, we'll make sure all those templates that are there, that the links to those, and they can be downloaded as well. So I'm happy for people to get access to those. That would be really good.
And can I just say just one more reminder that we do have the series of AgPal webinars coming up over the next couple of months. So yeah, please register and join the remaining webinars we've got planned for the rest of the year.
Thank you. Well, if there doesn't seem to be any other questions for this evening, so thank you so much on behalf of AgPal QIP and the PHN team. It's been a pleasure having you join us this evening. So thanks very much for making the time. I'll leave the link there for the evaluation. If you'd like to get online or ask any questions, please feel free to do so. And have a great evening, everyone. Thank you very much for joining us this evening.